first ever ProTeam University podcast. Our podcast will discuss a variety of topics, but today's topic, we're speaking to our in-house expert, CSCS and tactically trained sports strength conditioning expert, Mike Zangl. And we're going to focus our discussion on assessment, movement assessment. We do a lot of that for our company, but in talking to agencies all over the United States, it's a topic we continue to find ourselves going back to. And we thought, why don't we just make this a little more accessible for our folks and hop on a easy 15-20 minute conversation about it and really hear the behind the scenes kind of stuff and the questions we often get asked. And hopefully in our discussion today, we'll answer a lot of the questions you find yourself asking yourself or within your agency or department, and we can kind of give you the trade secret, so to speak. So without further ado, I'll let Mike take the lead on the conversation.
No, thanks, Beth, for putting this all together. And again, just having a conversation and giving as much information as we can to people in either the tactical world or whoever's listening to this. Obviously, our movement stuff is the basis for everything we do. And fortunately, I think you and I together have had a lot of experience with assessments and being in different areas and different fields. So, I mean, I guess the first thing is, how do we define movement, right? What is definition of movement? And I could say right off the bat, there's 100 different definitions. It depends who you talk to, right? You talk to a movement professional in one sector of the world, they're going to tell you one thing. You tell someone else, ask somebody else, they're going to tell you something else. But I think for us, it's a combination of things, and it's flexibility. It's where your joints are. It's how you moving in relation to your job. You know, can you be stable on one side and mobile on the other? So there's many different ways to look at what movement actually is and what its definition is. I think,
so,
yeah, go ahead. Yeah.
Not to interrupt, but this is how this is going to probably end up going. You said a word that kind of gives me like, not anxiety, but my patients oftentimes, and the people we talk to oftentimes say like, I've never been flexible, because you said flexibility, and it's just interesting how they view movement as well. And movement assessment, then on top of that, they think they're going to sit and reach and touch a box, their sit and reach test and all these like really standardized, like universally used things. I'm not saying they're not valid and reliable, but I'm just saying that our philosophy just goes far beyond that. And I know obviously you're one of us, you understand that concept, but also too, like the whole, if you're a bad mover and don't have great movement capabilities outside of your gear for your job, like you kind of already said, then man, just imagine how much compensation is going to be happening in your gear and on the job. And then just like we know, compensation and injury go together. So
yeah, and I think this idea of mobility or flexibility, whatever term you're using, it's kind of like this little inverted U theory, where there's too much flexibility, there's not enough flexibility. There's kind of that middle ground where it's optimal for whatever you're trying to do. So, a gymnast is going to have off the charts flexibility because they need that. Certain sports, their flexibility, they don't need to be squatting, their butts all the way to the ground. So how much gear they actually have. But like you said, we want to optimize that as best we can. So when they do put that 70 pounds of gear on as a firefighter or wear the tactical vest as a police officer, they have that experience of movement in those ranges of motion. So that gear doesn't hinder them and get them injured. So if we can get them to raise their arm overhead in a smooth fashion, when they do it with gear on, they're going to be able to do that because they've already experienced those areas of motion. So it depends who you talk to. I work with people all the time. They say, I'm not flexible, I can't touch my toes. But then I have them go through some other assessment. It's like, no, your mobility is where it needs to be. Just because you can't touch your toes, that doesn't mean anything. That could mean other things too. But it's just having those different areas and perspectives. And then obviously learning how to screen for it, right? Touching my toes is one of 100 different ways I can see how someone's moving. But there's obviously other ways to do that. So, I mean, in the rehab setting, you're using different diagnostic tools and troubleshooting types of, tests and things like that. In the strength world, we use different ones. We're not clinicians, so our scope's different, but we're we're using different tools in regard to that. So it's a very broad conversation to have. And I always, most of the answers I give, it depends. And it depends on X, Y, and Z, or what situation you're in. So, it's a loaded question, and I've noticed that over the years. But I think if we're defining movement, and this is my basic definition that I use just across the board, is can I get into a certain position or posture? That's it. Can I get into it? So if you want to stand on one leg, I need to be able to get my hip to 90 degrees or above 90 degrees. If I can't do that, then I don't have the mobility to do that. So like my hip doesn't move the way it's supposed to. Can I get my arm overhead? Okay, can you do that? Yes or no? Do you have the mobility, the requisites to do that? And I keep it as simple as that. If you can't get into that position or posture, you can't stand on one leg, you can't, stagger your stance, you can't reach overhead. That's kind of the basis of the definitions I use. I don't know what you use in the past, and I know we have our definitions in our company, but there's always different ones in rehab. Again, many ways to do different movements, but I guess in the rehab setting, what kind of stuff are you guys doing in terms of diagnostic tests, or how do you screen for movement? And then we can kind of ping pong back and forth here about, because the strength side is slightly different in terms of how we do certain things. So
Yeah, I mean, in the rehab side, what my mind immediately goes to is like the use of the DARI, because obviously that's what we use, and I know that that's not a universally used diagnostic, but I guess diagnostic's not a right word. That's my clinical brain though. But I will say that if someone's gone through the DARI and we have their movement, their outcomes on them, I'll ask my patients to pull that up and kind of see if it's something that the DARI would have otherwise been able to detect, because it has a pretty good accuracy as far as what it's detected so far among the agencies that we work with. But it doesn't even have to be that complicated. Like if you just do an ankle screen, if you just do like a thoracic mobility screen. I mean, we've taken our people in our workshops through this stuff. And so like something as elementary and as easy as that can be used clinically as well. But my $1 million question for you is, are movement assessments, how do I ask this? Are movement assessments or like assessing movement a must?
So a couple of things with that. So it depends on, how much time you have, how many people you have working for you, how many people you're actually working with. There's people that, like, sometimes I'm by myself with like 30 people. I'm not going to be able to go through a functional movement screen or a DARI assessment or something by myself. So doing a full movement assessment may not help. But if you design your warm-ups and your sessions appropriately, you can evaluate and movement screen as you go through certain things. So a full movement assessment system, not always applicable for a lot of different things. As you can hear, there's a lawnmower in the background here as I explain this, but it's kind of funny. But it depends. If I would love to do a movement assessment on everybody, it's not always applicable. You can't always do that. But what I've found, yeah, go ahead.
Oh, go ahead.
No, I was going to say is what I found is I try to split those up. So if I have 10 movement assessments I want to do or screens I want to do, I implement them one at a time. So if I, phase one of a training session could be, I'm just going to screen them on leg raise, and that's what I'm going to focus on. All right. Next one, I'm just going to screen the shoulder mobility. I'm going to focus on that one. And I can kind of split up a whole system over a 12-week span. And I can still improve on different movement sections and motor control and whatever else we're working with.
And for you being in the, the educational background you have and the experience you have, that seems like small potatoes, right? But I try to put myself in the police officer's mind, firefighter mind, a PFT mind, or anyone that's in charge of running academy recruit training and their PT or even ST or DT, whatever the agency calls it. And I have a class of like 30 to 60 people. And I also don't have maybe a CSCS background, or I do, but I still just don't exercise that muscle very often. And so like, what's the most applicable thing? What's going to give me the quickest answers? What's going to give me the most information I need to know so that I don't hurt these people during training, or I know how hard I can push them and I know what to look for in compensation?
Yeah. So if we're going that route, I would focus on 3 areas first. I would focus on ankle, hip, and that thoracic, that upper back mobility. Those are the 3 things I'd focus on immediately. By doing that, you're going to kind of check mark some other things, right? So if my ankles become more mobile, in theory, relatively, my knee should become more stable, right? I should improve my balance. My knee should be more aligned. I should hopefully mitigate some of the knee pain or some of the issues I have with squatting or running or, doing any lower body movement. With the hips, I think we all understand how important the hips are to walking and running and just performance in general. Low back pain, getting that hip working the way it's supposed to. And then that upper back and that shoulder joint, that's where most of the force production and movement's coming from in the upper body. So I think if, a police officer is running an academy or an instructor, if you can focus on those three areas, it's going to kind of check mark and check different boxes as you go along. I've no matter what warm up or whatever I'm doing, those are the three things I have in every single one of my programs. So even if someone has good ankle mobility, I'm still going to do it for them. I'm still going to manage it. They're still going to do it because you just never know, especially with the boots and shoes people wear, that ankle mobility can be lost pretty quick. And just keep, always working on it. The way we sleep, we have a natural foot drop when we sleep. So that's, that could hinder your ankles just overnight if you sleep in a weird position. So I think I would focus on those three areas. Yeah.
Yeah, and that's so interesting too, because like the injuries we see are shoulders, backs, and knees, right?
Mm-hmm.
And we're working on the mobility above and below all those joints. And usually because we don't have the mobility we're supposed to have, that's how we're injuring stable joints, right?
Mm-hmm. Yep.
To your point about boots and everything, right? Think about what these folks are wearing and like what we're seeing get injured. Yes, their boots are very, at least on the law enforcement side, almost like an ankle brace, because they're like those combat style boots usually, even if they're super light, they're up the leg and lace ups. And like half the time won't even give our people ankle braces because like it's too much, it's too bulky, and it's already like more uncomfortable than it should be. So it's funny that the injuries that we're seeing, you would think that we'd be seeing these like really traumatic things, and we oftentimes don't. We're just seeing like things that we could almost have predicted to happen if we would have maybe seen a movement assessment on them or done anything kind of like that before in their life, or changed their mindset about like what flexibility means versus mobility. So I asked my $1 million question, like, is it important? And like, it depends is definitely an option, but then it's like, well, what do you do? Well, there's people like ProTeam that can help you with these things, and we just hope that folks that come to this podcast today can kind of understand our mind and our mindset and our philosophy on it. That like mobility matters more, and that falls in line with the assessment piece is just like knowing your baseline. Do we care that you're powerful? Absolutely. Do we care that you can pull your buddy out of a bad situation? 100%. And do we care that you can be a strong backup for your beat partner? Absolutely. But we also care about the longevity and endurance that you have too. But like, I know you folks, we hear this all the time too, is like, well, I used a bench or I used a back squat like 450 pounds. That's important and great for whatever age and time span of life that was. But when we're talking about the long stuff, we're talking about the long game, we're talking about assessment on like as our basement to the rest of everything else.
Right. And it's it's one of those things where it's joint health, right? That's all we're working towards. It's joint health. I mean, you can't reverse. Everyone talks about age and aging and things like that. You can't add years to your life. You can maximize and optimize, what you currently have, and kind of slightly slow it down. But at some point, it's you can't fight the aging process in terms of your joint health and just overall. So, like you said, the 19-year-old firefighter or police officer coming in, off, whoever it is, 19, 20, 21 years old, whoever it is. Yeah, they can get away with bench pressing and squatting and going to CrossFit class and doing all that stuff. But when you're 40, 45, 50, getting to the tail end of your career, that stuff's not conducive for you. Your body can't handle it. You got to do things that are going to make you feel better and think the long term what's going to happen after you're done, working as a first responder. And that's that's a mindset. That's an education. That's one of the reasons why we're doing this podcast, right? It's just to get that information out there so people have a different. We're not telling people what to think, but just how to think differently on a lot of different things. And just the screening aspect of it is important. I'm kind of a weird story, a segue here, but I was watching something on TV one day and they had one of the old U.S. Secretaries of Education on. I won't say who it was because I don't want to cause any issues. but he was talking about how the best way to, grade reading proficiency and math and, our literacy was screening. And I was like, okay, well, we have movement literacy, right? You could bench, you could squat, you can deadlift all this weight, but if your movement literacy or your movements of joints are not good, you're just asking for trouble, asking for disasters. So, you might be able to bench 400 pounds, but that shoulder is just cranking away in there and it's not healthy for you. You'll be able to do that for 2 months and then you'll be hurt and out for 6. I'd rather you bench 200 and be healthy and be good for a long term. So, yeah, it starts with that screening process. And, obviously screening, testing, evaluation, 3 different things. Testing is, hey, we're getting that number and we're comparing it to other people. There's metrics to it. There's normative data on it. Like, we're really trying to push it. And then an evaluation is, do I have the expertise to evaluate that information? Like, if you do something in the rehab setting, I might not have the expertise or the background to evaluate that information or look at that. Same with a firefighter, police officer. That's not their scope. That's not what they do. So there's different lines here. Screening is yes or no. That's pretty easy. But testing and evaluation are 2 different things. So, yeah.
So my next question along those lines, then I already asked, like, does screening matter? And of those 3, screening, testing, and evaluation, and you answered the one question about, like, what are your going to be non-negotiables, like your ankle, thoracic, and hip. Was it hip?
Yeah. Yep.
Okay. So my number 1 is, like, can your knees go over your toes? With your heels staying on the ground, because everyone's like, don't put your knees over your toes. I don't know where that idea came from. When we run, when we walk, when we squat, I mean, generally speaking, our knees are probably going to go over our toes. So, like, if that's just our baseline, then, like, people who are listening to this, like, can you do that? If you can't, like, 0 for 1, because we're talking about a 0 and 1 kind of binary scale is how we look at it. But just to make it simple, like, you can or you can't. The other one I think is yours as well, is like hip flexibility, right? Where you lay down, kind of bring your knee to your chest as your leg pop off the floor. That's going to be your hip mobility one. And then the last one is just, can you touch your fingers behind your back, side to side here? And a lot of people, I mean, especially with putting their belts on or even turning on their air, that's a big one. And they can't do it. And, like, this is just really basic shoulder health, really basic hip dynamic mobility, and then, like, really basic, lower extremity mobility. So those are your 3 heavy hitters, and take 3 seconds to do.
Right. Yeah. And again, the time constraint's the big one, right? You hear people all the time, like, I don't have time to do all these things. Well, you can see if someone can rock their knee forward, flex their hip, and put their hands behind their backs. Like, that's easy to do.
Yeah.
Which you're going to get some arguments here about, is that objective enough, right? Kind of the subjective, objective thing. Nothing's 100% objective, right? There's always going to be slight variations in there, depending on who's doing the testing, who's watching the test. But we're in a fast-paced environment, like a fire academy or a police academy. Like, that information is gold. And you can know what to work on immediately and save somebody from being a recycle or going back into the rehab setting. So.
Well, and you bring up a good point. That information is invaluable. We're explaining in this moment right now the what. So the what's the assessment, and, like, what are your big 3 assessment pieces. The now what, though, is what a lot of people come to us for, is like, well, okay, I did these things, but now I don't know how to improve ankle mobility, or I don't know thoracic mobility, I don't know hip mobility. But the great thing is, there are courses on our site that you can take to learn about that. You can reach out to any of us one-on-one to ask more questions or get free consultation. We want to be a point of resource. We're also not, like, just in it for a money grab. Like, we want to talk to anyone and everyone who wants to talk to us about things and find what best fits and suits you. And so that's why we wanted to have these kind of, like, short bite-sized moments together where we're sharing our inside expert knowledge. You might not agree with everything, and that's fine too, but this is just what we do every day and what we see every day on the clinical and performance side. We know that you guys do this every day as the people in the street side, but we see you once you're hurt, at least on my end, and then you see Mike, preventatively. But with those reactive and proactive approaches, like, we still see and think the same way. And this is kind of like that knowledge that everyone, can I ask you this question? Can I ask you about this? Like, these are those questions that we get. So with the last bit of time here, what else do you want to leave our audience with?
Well, I think it's how do you, like you just mentioned it, like how do you, you have the test, you have the information, what's the solution to this? And it doesn't have to be rocket science, right? You're not looking at some crazy like 5 or 10 exercise routine for each part of that assessment that'll take you too long. So it could be easy as just, hey, I tested the ankle, put my hands on the wall, I see if I can push my knee to the wall. You could legitimately practice that same test and keep doing it and doing it. Your body gets used to it and you can work on mobility that way. That's like the simplest, like ground-based version to do it. There's obviously things like foam rolling. There's things like we talked about in our workshop with some of the neurological waking up and kind of poking around a little bit in there. There's arguments out there that going through strength training movements and letting someone explore their movement in an unloaded fashion can get them more mobile in those areas. It kind of depends on what you're doing there. But I think the biggest thing is from an application standpoint is you can improve those areas, ankle, hip, T-spine, shoulder, whatever the case may be. You can do it during a warm-up. You can implement that stuff within a workout. So if you're talking about the police or fire academies, they're doing all kinds of stuff, right? They're, moving equipment. They have their own training sessions. You can just sprinkle those things in throughout a session and you're still working on it. Like it doesn't have to be this whole separate thing that takes forever. And then again, it's just about building routines outside of what their jobs are. Is there a way to get someone to plan 3 to 5 minutes of their day after a shift or when they go home to move their ankle in a circle, to hug their knee to their chest when they lay on the ground, to just put their hands over their head or stretch their chest out on a wall? Those, one of the best, sayings I ever said is, what is an ounce of prevention is a pound of cure, something like that. So if you spend a little bit of time, it's going to go a long way. So I think that's what I would leave people with. And again, this could be a 4-hour podcast if we wanted to, but one thing I would add too is like, don't collect too much information because you're going to have to manage all that information. So you don't want to test for 50 different things. There's no way you're going to be able to manage all that and improve every single one of those. But if you have, like you said, 3 to 4 different things you can focus on, your improvements are going to be just that much better. And I think that's the starting point for a lot of people that are not coaches, that don't have the background. But yeah, it's try to keep it as simple as possible and go from there.
The KISS method, keep it simple, stupid.
Yep. Yeah. I think they took the stupid part out of that for some reason. Probably someone got their feelings hurt or something. I don't know.
Well, we're going to hurt some feelings probably talking about controversial topics in the future, and just kind of maybe not outside the box stuff, but just contemporary, different lens, different perspective. I think this is a great first start to that. And hopefully those that are listening in, it sparks a little bit of curiosity or just kind of affirms maybe what they're already doing, or it's completely new ideation for them. And that's okay too. We want to just, the people that we interact with, what I want all of our listeners, agencies, and folks that we work with to know is like we care about you as a first responder, but we care about you as a person too. And so these things that we're talking about as far as longevity and how you feel overall is how you perform your work, but also how you feel as a person. And that's like the little details like this that make all the difference. And I just want to thank you for your time today and the topic. There'll be many more topics down the road, and we hope that this was the first one that everyone enjoys listening into and sparks some interest. And
yeah, for sure.
yeah, thank you so much for your time today.
Thank you.